Why most shoulder pain may actually begin in your neck. The hidden connection between the cervical spine and shoulder function. Presented by Dr. Masoud Shamaeizadeh, Soft Touch Chiropractic, Porter Ranch, California. Is your shoulder really the problem? Many people assume that shoulder pain starts in the shoulder, while injuries such as falls, rotator cuff tears, or arthritis can certainly cause shoulder pain. Many chronic shoulder problems develop gradually because the muscles controlling the shoulder are no longer working in proper balance. The surprising part? The imbalance often begins in the neck. The shoulder is unlike any other joint. Unlike the hip, which is built for stability, the shoulder is designed for maximum freedom of movement. The shoulder can reach overhead, reach behind your back, rotate in almost every direction, lift, push, pull, throw, and carry. This incredible range of motion comes at a price. The shoulder depends heavily on healthy muscles for its stability. Instead of relying primarily on bones and ligaments, the shoulder stays centered because many muscles constantly work together to keep it aligned. Think of these muscles as a team. If one player becomes weak or another becomes too tight, the entire shoulder begins to function differently. Muscle balance is everything. Healthy shoulder movement requires a balance between chest muscles, pectoralis muscles, upper trapezius, lower trapezius, rhomboids, rotator cuff muscles, serratus anterior, deltoid muscles. Modern lifestyles often create muscle imbalance. Examples include sitting at a computer all day, looking down at a phone, driving long hours, poor posture, weight training that focuses mainly on the chest and front shoulders. Many people strengthen the front muscles while neglecting the muscles that stabilize the shoulder blades. Over time, this imbalance changes how the shoulder moves. The AC joint and sternoclavicular joint can become stressed. As muscle balance changes, the shoulder girdle may no longer move efficiently. This can place increased stress on important joints such as the acromioclavicular AC joint, the sternoclavicular SC joint. When these joints are repeatedly subjected to abnormal forces, people may experience clicking, popping, pinching, limited motion, pain when lifting the arm, weakness. Left uncorrected, abnormal mechanics may increase wear on tendons and other soft tissues over time. But what controls those muscles? Here's the question that often gets overlooked. What tells those muscles how much to tighten or relax? The answer is your nervous system. Every shoulder muscle receives its instructions through nerves that originate from the cervical spine, neck. These nerves influence muscle tone, muscle coordination, reaction time, joint stability, movement patterns. If the neck is not functioning properly, it may affect how efficiently these muscles work. Could the neck be the missing piece? Many people notice shoulder pain without realizing they had neck stiffness, poor posture, limited neck movement, frequent headaches, muscle tightness, months or even years before the shoulder became painful. While not every shoulder condition starts in the neck, cervical dysfunction can contribute to altered shoulder mechanics in some individuals. Addressing only the shoulder without evaluating the neck may leave an important contributing factor untreated. What happens over time? The process often develops gradually. Stage 1. Neck dysfunction affects nerve and muscle function. Stage 2. Muscles begin losing proper balance. Stage 3. The shoulder no longer stays perfectly centered. Stage 4. Abnormal movement places extra stress on tendons, ligaments, and cartilage. Stage 5. Pain, inflammation, reduced motion, and weakness become noticeable. By the time shoulder pain appears, the underlying movement problem may have been developing for a long time. A chiropractic approach. At Soft Touch Chiropractic, we evaluate more than just where the pain is located. Your examination may include assessment of cervical spine mobility, shoulder mechanics, muscle balance, posture, joint motion, functional movement patterns. If appropriate, chiropractic care may help restore normal spinal and joint motion, while rehabilitation exercises can improve muscle coordination and stability. The goal is not simply to reduce pain, but to improve how the entire shoulder system functions. Don't wait until the damage is done. Pain is often the last sign that something has been changing for months or even years. The earlier muscle imbalance and movement dysfunction are identified, the better the opportunity to improve function before more significant tissue irritation develops. Your shoulder doesn't work alone. It works together with your neck, nervous system, muscles, and posture. Understanding that connection could be the key to lasting improvement. Schedule your shoulder evaluation today. If you've been living with shoulder pain, neck stiffness, clicking or popping, limited range of motion, pain reaching overhead, weakness when lifting, don't just treat the symptoms. Find out whether your neck and nervous system are contributing to your shoulder problem. Dr. Masoud Shamaeizadeh, Soft Touch Chiropractic, 11145 Tampa Avenue, Suite 14A, Porter Ranch/Northridge, California, 91326. Phone 818-831-0100.